disorders section. YouTube headings hashtags for easy use on your channel. PEBC-style case-based MCQs, anxiety disorders. Q1, first-line gay D. A 30-year-old woman presents with excessive worry, muscle tension, and poor sleep for the past 6 months. She denies substance use. Best initial pharmacologic choice? A. Diazepam, B. Escitalopram, C. Buspirone, D. Hydroxyzine. Explanation. SSRIs, SNRIs, e.g. escitalopram, venlafaxine, are first line for generalized anxiety disorder, GAD. Benzodiazepines are only for short-term or adjunctive use. Reference CTC 2018, P40-41. Shahmer Q2. Panic disorder, acute treatment. A 28-year-old man presents to the ED with palpitations, sweating, and fear of dying. ECG is normal. He has recurrent episodes. Best acute treatment? A. Lorazepam, B. Sertraline, C. Propranolol, D. Haloperidol. Explanation. Benzodiazepines, lorazepam, alprazolam, clonazepam are useful for acute panic attacks. SSRIs are used for long-term prevention. Reference CTC 2018 P42 Q3. Panic disorder. Maintenance. A 32-year-old woman with recurrent panic attacks wants long-term therapy. Best option for maintenance? A. Sertraline, B. Alprazolam, C. Hydroxyzine, D. olanzapine. Explanation. SSRIs, sertraline, fluoxetine, paroxetine are first line for panic disorder maintenance. Benzodiazepines are not recommended for long-term use due to dependence. Reference CTC 2018 P42. Q4. Social anxiety disorder. A 25-year-old student avoids presentations due to intense anxiety and fear of humiliation. First-line treatment? A. Propranolol as needed. B. Paroxetine, C. Buspirone, risperidone. Explanation. SSRIs, paroxetine, sertraline, and venlafaxine XR are first line for social anxiety disorder. Beta blockers may be used situationally, e.g. public speaking. Reference CTC 2018 P43. Q5. Social anxiety. Performance only. A 35-year-old executive has anxiety only before giving large presentations. Otherwise, he functions normally. Most appropriate treatment? A. Propranolol 1 hour before presentation. B. Daily paroxetine. C. Alprazolam 3x daily. D. Buspirone. Explanation. For performance-only social anxiety, beta blockers, propranolol, atenolol are preferred. Daily SSRIs are for generalized social anxiety. Reference CTC 2018 P43. Q6. PTSD. First line, a 40-year-old woman with PTSD after a motor vehicle accident has nightmares and flashbacks. Best pharmacologic therapy. A. Risperidone. B. Diazepam. C. Sertraline. D. Prazosin. Explanation. SSRIs, sertraline, paroxetine, fluoxetine are first line for PTSD. Prazosin may help with nightmares but is not first line overall. Reference CTC 2018 P45. PTSD. Resistant nightmares. A 44-year-old veteran with PTSD is on sertraline but continues to have nightmares and poor sleep. Best adjunctive therapy? A. Prazosin. B. Clonazepam. C. Quetiapine. D. Amitriptyline. Explanation. Prazosin, an AT1 antagonist, is effective in reducing PTSD-related nightmares and sleep disturbances. Reference CTC 2018 P45. Q8. A 27-year-old man presents with excessive worries about job performance and insomnia. He denies rituals or repetitive behaviors. Most likely diagnosis? A. Obsessive-compulsive disorder. B. Panic disorder. C. Generalized anxiety disorder. D. Social anxiety disorder. Explanation equals chronic excessive worry without compulsions rituals. OCD has compulsions. Reference CTC 2018 P40. Q9. Duration of therapy. A 34-year-old man with panic disorder responds to sertraline. He wants to stop after 3 months. What is the recommended duration of therapy? A. 3 months. B. 6 months. C. 12 months. D. Light explanation. Continue pharmacotherapy for at least 12 months after remission to reduce relapse risk. Reference CTC 2018 P42. Q10. Benzodiazepine use. A 58-year-old woman with GAD has poor sleep despite being on escitalopram. She asks for a benzodiazepine. What is the best recommendation? A. Long-term clonazepam. B. Short-term adjunctive lorazepam, then taper. C. Diazepam PRN indefinitely. D. Switch to haloperidol. Explanation. Benzodiazepines can be used short-term as adjunctive therapy in GAD, but SSRI-SNRIs remain first line for long-term use. Reference CTC 2018 P41.